Hello everyone. So today we're going to be talking about fundamental respiratory care, basics to understand for the nurse. Our goals today include, upon the completion of this module, the student will be able to assess and evaluate patients for selected respiratory care needs, demonstrate common modalities of non-critical respiratory care, and collaborate with other health team members to plan approaches to respiratory treatment and management of the non-critical patient. Our objectives include, by the end of this module, the student will be able to assess and evaluate patients for selected respiratory care needs, understand the indications and hazards of oxygen therapy, aerosol therapy, and humidity therapy, demonstrate the appropriate use of oxygen therapy, and have a basic understanding and indication of incentive spirometer, and lastly, understand and assess a patient for basic bronchodilator therapy. Okay, with respiratory care, nursing, even though they don't do a lot of the treatment modalities themselves, they are going to be working very closely with the respiratory therapist. And I think this is important to point out because a nurse is going to be at bedside a lot more than the respiratory therapist will when it comes to patient care throughout the day. So collaboration is key. The two things that are important to note is that it improves healthcare practice and it improves quality of patient care when you have collaboration between the nurse and the respiratory therapist. So exactly what is the nurse responsible for when it comes to respiratory care? Well, assessment is going to be key. So the nurse as well as the respiratory therapist need to know what the patient's history is, what the diagnosis is the patient already on respiratory medications, and then direct assessments when they walk into the room. The most important is my patient breathing? Is my patient using accessory muscles if they are breathing? So some indications of whether or not they are in distress or they need assistance. And then is my patient on oxygen or is oxygen indicated? So if a nurse can walk into the patient's room and assess the patient very quickly and decide whether or not they need respiratory care, that's going to be one thing that's very important. Okay, so one of the most important things as far as respiratory modalities, treatment modalities go, is oxygen therapy. And we have to remember that oxygen is a drug and we do have to have an order for it, but a lot of times oxygen, especially lower flow oxygen devices, are involved with protocols within institutions. So with oxygen therapy, some indications for that would be, well, number one would be the documented hypoxemia, which means if a patient's PaO2 is less than 60 millimeters of mercury, or their SaO2, which is their saturation, is less than 90% on room air, that the patient may have an indication for oxygen therapy. I think it's important to point out that some patients that have certain respiratory diseases, such as COPD, they will have SaO2s, typically, if they're chronic, lower than 90%. But a lot of times, if they're chronic, they're already on oxygen. And so we have to be careful about increasing their oxygen. Also, acute care situations where hypoxemia is suspected, so severe traumas that come into the emergency room, acute MIs, and then finally short-term therapy like post-op anesthesia recovery. These patients will be on oxygen. Some common oxygen devices that you will see as a nurse. The first one is the nasal cannula. So that's a low flow oxygen device. We give anywhere between 1 to 6 liters of oxygen with nasal cannula. And if you look down at my screen, I have one here. It's kind of hard to see, but I think one of the most important things as a nurse and also for the therapist is that this device gets put on correctly. So a lot of times as therapists, we may see this device put on this way, and that's wrong. So this nasal cannula needs to be put in the nose and then over the ears like this. Okay. The second device is the Venturi mask. This device can deliver 50%. It's very specific to what percentage it gives, and we can change it 30%, 40% FiO2. So if the physician's very specific about how much FiO2 we give, then we want to make sure that we're giving it with the Venturi mask. I think the important thing about Venturi mask is that the patient doesn't put the covers over their face, that the nurse knows not to increase the FiO2 on the wall. It's very specific how much liter flow that we give with Venturi mask, and that the indications for it. As far as a non-rebreather mask goes, this is the device that we use to give as close to 100% as possible. So this device has a bag. If you look down at my screen again, has a bag at the bottom. Okay. And the important thing about this device is that we want to make sure that the liter flow is strong enough to inflate this bag. If it's not inflated, then the patient's not going to be getting as close to 100% as possible. And then finally, the bag valve mask. Obviously, this is in emergency situations when the patient has a very, very low, shallow respiratory rate, or if they're not breathing at all, then we can assist them. Because oxygen is a drug, we need to be aware of hazards of oxygen therapy. The first one would be oxygen toxicity, where we give too much oxygen for too long a period of time. So we want to limit the 100% FiO2, and we want to keep the FiO2 below 60% as quickly as possible. Also, depression of ventilation is another hazard. So this means with COPD patients, they have a hard time when we give them too much oxygen. It completely knocks their drive out to breathe, and they don't want to breathe on their own. They get lazy, their breath is shallow, and it also gets very low. And then finally, a fire hazard. This is very important with patient education and when the patients are outside of the hospital. Incentive spirometer is actually going to be something that a nurse may be at the forefront with. A lot of times hospitals will give an incentive spirometer to their patients without an indication of respiratory therapy beyond incentive spirometry. So it promotes lung expansion, and the indications is to prevent atelectasis, specifically postoperatively, but it also can prevent atelectasis in other types of patients as well. So it's also used to prevent pneumonia. And I think the big thing with incentive spirometry is patient education, making sure that the patient knows how to use it and what they're doing with it and why it's important. The next treatment modality as far as respiratory care goes is bronchodilator therapy. This is a basic therapy, and even though nurses may not give the bronchodilator therapy, they need to know the indications, hazards, and special considerations when it comes to bronchodilator therapy. So the indication is reversible airflow obstruction. If you hear wheezing, sometimes the wheezing is indicative of the patient needs bronchodilator therapy. Hazards and adverse effects would be dizziness, hypokalemia, nausea, and tachycardia. And then finally, with the special considerations, congestive heart failure patients a lot of times will sound like they may need bronchodilator therapy, but really what they're needing is Lasix to get rid of the fluid and the wheezing that's being caused. So I think it's important for nurses to know the patient history of congestive heart failure and go back and look and make sure, hey, did my patient get Lasix that day, or do they need Lasix versus bronchodilator therapy? So this concludes my PowerPoint for today. If you have any questions, please reach out, and these are my references. Thank you.